Karen, my production manager, she has just gotten back from maternity leave. Yay! She sent me this article. It's called The Silent Struggle, Calling for Improved Maternal Mental Health and Postpartum Care. We hear a lot about postpartum depression and things like that, but I think it's really important to highlight that a majority of peripartum pregnancy-related deaths occur after delivery and not inside the hospital. That is a really key point because we talk a lot in the United States about maternal mortality, but often we are not really talking about things that happen outside the hospital and how to improve access to postpartum and antepartum before delivery care, which is what is key to actually actively reducing that maternal mortality rate. And in my comparison of being here in New Zealand, there is a massive difference in how much care and attention people get after they leave the hospital when they've had a baby. Here, the midwives check in with them at their home for like 6 weeks at least. And then they also are then visited by what's called plunket nurses, which are there to check in on the milestones of the kids. Like, it's a really great setup. And it's hard in the US because we don't have the medical infrastructure to just implement that. Like, as an obstetrician there, I was doing all the things I do here, plus what the midwives do. And there's no way we could replicate what's done here in the United States because of the way healthcare works. But I do think it's really important to discuss postpartum care and access when we're discussing things like mental health, maternal mental health, and maternal mortality. Here we go. So in the celebration of birth, the spotlight often shines brightest on new arrivals. However, the mental health needs of mothers, especially during the postpartum period, remain underaddressed. Recent findings from the Harris Poll's third annual State of Maternal Health in America study, to be released in coming months, that will be really interesting. We'll definitely go through that on the channel, brings to light a critical issue with a significant percentage of women who have been pregnant experiencing mental health issues during the pregnancy journey, and even more voicing concerns about inadequate post-birth healthcare. It's high time we turn our attention to improving maternal health services. Okay, so this is going to focus a whole lot on mental health specifically, it sounds like, which is great. But I want to again reiterate that this would encompass all care, and every kind of outcome would be improved by better postpartum care, including mental health, which is a cause of some peripartum deaths, but also just having more oversight in general would improve maternal mortality, even if the focus is on mental health. Because if you have access to mental health care, you're also going to have somebody who can go, hey, that physical thing you're describing may not be normal either. Why don't you have it checked out? So a staggering 77% of women feel there is not enough focus on healthcare for mothers after pregnancy and birth, including over a third who strongly echo this sentiment. I'm actually surprised that's not higher. The oversight is further highlighted by the 65% of women who feel mothers become an afterthought once the baby arrived. I see that clinically all the time. The obstetricians don't do that because I'm not taking care of the baby at all. But it certainly feels like that sometimes in the hospital, and definitely after you've left the hospital. A sentiment that is slightly down from 71%, which that's good because maybe we've been making a little headway in highlighting the importance. 1 in 4 who've given birth, 23%, say that postpartum care was less than adequate, and just under 1 in 5 report above and beyond care. Insufficient follow-ups and mental health challenges. Postpartum care is crucial, yet 84% of women argue that the standard 6-week postpartum checkup falls short. Definitely. There should be more check-ins than that. 6 weeks and a 20-minute visit, if that, is not enough. Mental health stands particularly as a concern with 2 in 5. I don't like how they're using all these numbers and putting 2 in 5 and 38%. Can we just stick to 1? It's confusing. It's too many numbers. 38% say that a healthcare provider diagnosed them with a mental health condition during their pregnancy, which is up from the previous year. This includes things like anxiety, depression, postpartum depression. It's weird that they've split that up between depression and postpartum depression. Postpartum depression is technically under the umbrella of peripartum depression, which also includes a diagnosis that happens during pregnancy. We reference it as postpartum depression, but basically, if it's diagnosed during your pregnancy, it's pregnancy-associated anxiety or depression. If it's diagnosed postpartum, it's still included in that. It's just, was it during pregnancy or in the 6 to 12 weeks after? If it's diagnosed outside of pregnancy, like a pre-existing condition, it can be exacerbated by pregnancy. There's a lot of different definitions, but anyway, that's a side tangent. So despite the prevalence of postpartum mood disorders, only 24% who felt they have received enough information on resources. And I don't that's impossible to fix in the US with the current setup because even when I am a doctor who does this all the time, when I was in Texas, I couldn't get somebody seen for postpartum depression, anxiety in a reasonable time frame, hardly ever. And if it happened while you were pregnant and you needed inpatient admission, don't get me started. You cannot get someone admitted to an inpatient unit where they can get care for a psychiatric condition that needs care if they are pregnant, almost ever. And here, it's really awesome. We have a facility if you need inpatient care, it's like a maternal mental health facility that you can take your baby with you. And obviously there are safeguards around that, but we know that it's better for people not to be separated from their baby. And it's a barrier to seeking care if you're afraid that you're going to get admitted to inpatient and not be able to be with your baby. These are things that have massive impacts on outcomes. Younger women between 18 and 44 appear disproportionately affected, with 63% of that age group who are or have been pregnant reporting having been diagnosed with mental health issues by a healthcare provider, more than twice as likely as their older counterparts. That's interesting because there are so few people pregnant over the age of 45 that I find that really weird for them to break it down like that. That is not the focus of this, but is 18 to 44 really an age-related disparity in care and diagnosis when you're only comparing it to people who've been pregnant over the age of 45? I'm sure the sample sizes are quite different in that. I don't know. Maybe I'm reading this wrong. These younger women who've given birth and likely to have experienced birth more recently are also more likely to feel they have received less than adequate postpartum care compared to those aged 55 and older. Am I just dumb? What is the question here? Is it that's the ages that you are and if you've ever been pregnant? Or you were pregnant at those ages? I don't know. Let's skip that paragraph. Brad, cut that out so I don't look silly on YouTube. Or maybe leave it in if I'm actually interpreting it right. I don't know. It's confusing. Nearly a quarter of women who've given birth describe their postpartum care as inadequate, truly underscoring that healthcare system is failing to fully support new mothers. Every mother deserves to feel supported and cared for after giving birth, yet our findings indicate that our healthcare system often falls short. Yeah, I think most of us could have told you that. I think it's the age when you took the questionnaire, maybe. Maybe, yeah, maybe it's how old you are right now as you're taking it and if you've ever been pregnant in your life. I just don't understand what information that really gives you if you have people over the age of 55 saying they felt more supported than people. I don't know. My brain is not closing the gap on what information that's giving us. Okay, yeah, actually. So here it goes. The poll was 4,000 US adults, 18 and older, 1,600 of those having been pregnant or currently pregnant, and 1,500 having given birth. I don't know. It'll be interesting to see what all the results of the entire thing are, but I do think this is highlighting a really important gap in healthcare in the US, of which there are many, don't get me wrong. Don't worry, we have plenty to go around. I think everybody is a gap in healthcare in the US at the moment, but I don't have the answer. I have seen it work better in another system, but the way that it works here is not able to be implemented within the system we have in the US. And I think this is just one more reason to advocate strongly for universal healthcare, because that's not going to fix the problem, but it's going to make it better.